Shadow Secretary of State, Wes Streeting.
Thank you, Madam Deputy Speaker. Can I begin by thanking the Secretary of State for advance sight of her statement, and even more importantly, thanking Dr Hilary Cass and her team for the thoughtful and thorough way in which they've undertaken their work. She has navigated the complexities and sensitivities of this subject with academic rigour, providing an evidence-led framework for children to receive the best possible healthcare. I also want to pay tribute to journalists like Hannah Barnes and the whistleblowers who together helped shine a light on what was going on at the Tavistock Clinic. At the heart of the complexity around this issue are two things which are true simultaneously. There are trans adults in this country who have followed a medical pathway and who say that for all the pain and difficulty that involved, it wasn't just life-affirming, it was life-saving. There are also people in this country who followed a medical pathway who say it was a disaster, that it ruined their lives irreversibly, and they ask how anyone could have let this happen. For the sake of all of those children, young people, and now adults, but particularly those being referred into gender identity services today, we have a duty to get this right. What has emerged in the Cass review is a scandal. It is a scandal that children and young people are waiting far too long, often years, for care, while their well-being deteriorates and their childhood slips away. It is scandalous that medical interventions have been made on the basis of shaky evidence. It is scandalous that despite all this, some NHS providers refused to cooperate with Dr Cass's review. And perhaps the worst scandal of all is that the toxicity of this discussion means that people have felt silenced, and it required investigative journalism to prompt this review taking place. This particularly vulnerable group of children and young people are at the wrong end of all of the statistics for mental ill health, suicide and self-harm. There is no doubt that they have been very badly let down. So we owe it to them to approach this discussion with the same care and sensitivity with which Dr Cass undertook her review. There are parts of this report which will sound familiar to anyone acquainted with the NHS today. Children and young people face unacceptably long waiting lists. They are unable to get the mental health support and assessments they require. The services face significant staff shortages, with a lack of workforce planning driving all of it. As with so many parts of the NHS today, this report paints a picture of a service unable to cope with demand. Dr Cass is clear that care must be personal and holistic. So can the Secretary of State set out how she plans to cut waiting times for assessments for mental health and neurodevelopmental conditions? Waiting lists are so bad in some cases that children are passing into adulthood before they have had their first appointment with gender identity services, leaving them facing a cliff edge. Cass recommends follow-through services up to the age of 25 to ensure continuity of care. Can the Secretary of State provide an indication of how long she thinks it will take to establish these services? Madam Deputy Speaker, Labour welcomed the decision taken by NHS England last month to stop the routine prescription of puberty blockers to under 18s. The loophole that now exists for private providers risks sparking a black market. The Secretary of State has said she expects private clinics to follow the recommendations in this report, indeed to follow the evidence. Can I underline our support for her expectations on compliance? And can she give an indication as to whether she thinks further regulation may be needed to ensure adequate enforcement of the recommendations? Madam Deputy Speaker, the refusal of adult gender services to share data of the long-term experience of patients is inexcusable, as the Secretary of State said, and I agree. It is deplorable. The data does not belong to them. It belongs to the NHS and, crucially, to patients. Of course, I welcome that they are now coming forward, but I also ask the Secretary of State how this was allowed to happen and what accountability she thinks would be appropriate. Madam Deputy Speaker, this report must provide a watershed moment for the NHS's gender identity services. Children's healthcare should always be led by evidence and in the best interests of children's welfare. Dr Cass's report has provided the basis on which to go forward. The report must also provide a watershed moment for the way in which our society and our politics discuss this issue. There are children and young people in this country and adults, including trans children and young people and adults, who are desperately worried and frightened by the toxicity of this debate. There are healthcare professionals who are scared to do their job and make their views known. And Dr Cass has said, and I quote, "Toxic, ideological and polarised public debate has made the work of the review significantly harder," and she says it will hamper the research that is essential to finding a way forward. So in conclusion, Madam Deputy Speaker, can I say that even in this, a general election year, there is surely one issue on which we can down tools and work together, and that is in pursuit of the healthcare of vulnerable people. And can I also pay tribute to the Right Honourable Member for Bromsgrove? We had many scraps across the dispatch box, but for his role in commissioning this review, he deserves our thanks and respect. And I hope that I can work constructively with the Health Secretary to put children's health and well-being above the political fray.
Chief of State.
I welcome